COVID hospitalizations are the highest we've seen since the COVID vaccine was made available to the public. And that's why healthcare workers say it's more important than ever to get a flu shot. Local 5's Ryan Scott explains.
The hospitals are full, our emergency departments are full.
We also have that concern that when influenza hits, we're going to have again patients needing to be hospitalized for influenza.
That's why they're urging you to do your part and not only get the COVID vaccine, but also the flu vaccine as another flu season approaches amid the pandemic.
So receiving the influenza vaccine will help minimize that disease, and that disease alone is very similar to COVID.
Now, if you get sick during flu season and experience any of these symptoms like fever, cough, or shortness of breath, health experts say you may not know if it's COVID or the flu.
These illnesses are very tricky to tell apart. And so that's why we are really urging people to get vaccinated for both of them this year, especially.
If you're experiencing mild symptoms, hospitals and clinics can test to find out if you have the flu and COVID-19.
They are both nasal swabs for testing.
But if you are severely sick,
we definitely want you to get medical attention.
Unlike the COVID shot, the flu shot is approved for everyone 6 months of age and older.
Historically, about 50% of the population gets the influenza vaccine. So hopefully we can see influenza participation much higher this year.
Now let's take a look at this map provided by the Iowa Department of Public Health. This shows us where all the Iowans that are vaccinated against the flu live. So as you can see, the darker the county, the more Iowans are vaccinated within that county. As you can see with Central Iowa in particular, specifically Hamilton, Grundy, Boone, and Dallas counties, all have vaccination rates above 40%. In studio, Ryan Scott, Local 5 News, we are Iowa.
According to the CDC, flu season typically starts in October and ends in May.